Tuberculosis has infected 1 out of 3 people worldwide and continues to affect your community. Thank you to the courageous men and women who are sharing their stories in the hopes of spreading knowledge and understanding.
I was diagnosed with having TB back in, it was during the cold months, I guess, during the Christmas holidays when I started getting sick. They thought that I had bronchitis at first and then pneumonia. So I started taking antibiotics, but I wasn't getting any better.
With my experience on TB, it's not that great, and it's kind of like you're being sick all the time. It takes you away from family life where you want to go out and do stuff.
I had no strength, I had no energy to do anything, so I thought I was going to die. But once they found out that I did have TB, then they started giving me medication and I started getting better, feeling better.
They put me on pills for a month for everyday process. Then after the everyday process, and they started me up on pills and every 2 days and each week. I wanted to go out, go hang out, go visit here and there, but you can't really because they're trying to prevent from spreading it.
At that time I was taking Nortep, and because I was around my fellow students, students that were attending Nortep at that time, they had to get TB tested as well. So it was kind of embarrassing, but I couldn't help it.
Get yourself checked out if you had those symptoms like a lot of tiredness, restlessness. Maybe you kind of feel like you're overstressed or short of breath all the time from getting up, from standing up or sitting down, getting that short of breath, or you coughed and you're coughing too often, or you get sore on the back or in the chest area.
Anyone can get TB. It's, like I said, it's the air we breathe. Don't be shy about it. Seek medical attention if you think that you do have TB, or if you have symptoms of TB.
We've had some really different types of TB here too, which is unusual. We've also had people with TB of the skin, TB of kidneys. And TB can hit anywhere. It doesn't just have to be the lungs. You're tired, you don't have much appetite, you're usually losing weight, you have night sweats, productive cough. But those are the main things you look for.
If you feel like you have the symptoms, I think people should take action for their own health and be careful with it. What do? Approach the nurse or local nurse, or even see the doctor or wherever they are. Get themselves checked, get some, TB tests done.
Well, directly observed therapy is people get their medication. Once they're diagnosed, then they have to go on daily meds for a month, so they're no longer infectious. And they're told for, the first 2 weeks, they need to stay home and limit their contact with people. And so the TB worker goes every day and takes them their meds. And she stays there and gives them their meds and watches them take them. And that cuts down on the drug resistance. We have a few that'll come to the clinic, but the better way is going to them. And some people, they like being there like at 8:30 in the morning. Some people would rather see you around supper time. So you work around what's convenient for them. But if they're having any problems, they can phone us anytime. I mean, we work during the day, but then there's always a nurse on call after hours. And if they're having any kind of problems, let us know. I've seen people who come in with TB, and then once they get on meds and start feeling better, it's incredible the difference in them in like 3-4 months. Because then they can start, they start feeling better, they start eating more, and they just feel like a new person.
I had it when I 5 years old, right here. All I remember is coming out of the shower and having a big lump. And I didn't know what it was, but my mom was a nurse, so she knew there's high cases of TB in the reserve. And then I got sick again when I was 19. I just looked like death. And I actually had TB in my lymph nodes then.
I had TB. TB with meningitis. That's what they told me I had. And I was in the hospital in July, August, September, October.
I had surgery twice on my neck. They took lymph nodes out twice. And then finally, about after a year, they finally diagnosed that I had TB. And I went on meds, and I was actually pregnant when I was on meds, which was horrible.
In May, I kind of noticed that something was wrong with me, but I wasn't too sure what was wrong with me. I started having headaches, and something was not right. I knew that. And a lot of people tell me, like people that I talk to, and tell me you're lucky to be still alive. I went and see my TB doctor yesterday, and he told me that things are going the right way. I try to keep track of all the pills that I take. I try not to miss my pills.
It's been a tough journey, but
You're all clear now.
yeah, I'm all better.
That's good.
I have like a 2-year-old daughter now. She's pretty healthy.
If you think you have TB, you gotta watch. I think how so you don't spread it.
Get checked. Because obviously it went from being tired to stop eating to losing like 40 pounds and looking like death. It's terrible. I wouldn't wish it on anybody. So I just think being aware and like just taking care of yourself, even though you're tired all the time, still go get checked. It may be nothing, but or it may be TB. I guess you can never be too cautious, is what I'm saying.